Okay, we're good. Okay, well, yeah, welcome to the first Pro Bono Counseling Provider Onboarding session. So, normally we do this in the chat, but, well, sorry, before we start, we'd like you to know, just so you know, if you have any questions, we will have a few question and answer breaks. You can enter them into the chat box at any time. Of course, we again have a small group, so I'm sure you can just feel free to just ask. At the end of this orientation session, likely tomorrow, I will be sending out both the slides with all the links in them, as well as a post-presentation evaluation so that we can make any improvements, and especially given your expertise with the origin of pro bono counseling, I'm sure we would value that greatly. And then if needed, it doesn't seem like it, make sure to change your name on the meeting as well. All right, so let's do some brief introductions. We kind of were already introduced, but I'll introduce myself. My name is Dennis Smith. Pronouns are he, him. I don't have licensure, but I'm not a counselor, but I'm the behavioral healthcare navigator here. And I think Pro Bono Counseling is a fantastic program, and Project Access does amazing things. That's why I was interested in them when I applied, and very glad to be a part of it. So, yeah. Um, Stephen, would you
It's
like to
great.
introduce yourself?
Sure. I usually go by Steve. You can call me Steve
Okay,
if you'd
sure.
like. Steve Shapiro. And I actually work for public health here in Seattle. I've been here for 6 years now, a little
Okay.
over 6 years. I provided behavioral health services in various places. The most recent before I moved here 6 years ago was in Baltimore for 20 years, and
Okay.
a community psychiatry program there at Johns Hopkins. So I actually worked with pro bono counseling in Maryland for those 20 years. And so that's how I know Gary.
All right. Well, wonderful. Glad to have received your expertise as well for getting it
Thank
set
you.
up out here.
Thank you. Thank you.
Of course.
It's great to.
Uh, yeah, thank you. And Gary, I don't know if you want to introduce yourself.
Only
Seems like we
because
all
we're
know each
being
other.
recorded. My name is
Yeah.
Gary Rindell, and I serve as President and CEO of Project Access Northwest. Dennis, I'm thrilled to have you in your position. We're missing Charisse today, but I know she's with us in spirit. And I'm thrilled that our first call gets to have a legend within Project Access Northwest circles with Steve Shapiro on the line with us. So thanks for putting this together, Dennis.
Yeah, of course. All right. Well, so to go over the agenda, what we're going to do is we're going to overall review Project Access Northwest's mission and values, do a general overview of pro bono counseling to learn about what the program does specifically. We'll go over the client enrollment process so you can see from the client perspective how they enroll into our program, and the different methods to do that. We will discuss the roles of our PBC providers and how each of you fit into the program. And then towards the end, we'll go over all the exclusive info, the resources and benefits that come along with pledging as a provider to pro bono counseling. So our mission and vision at Project Access Northwest. Our mission is to improve community health by connecting those most vulnerable to vital healthcare services. And our vision is that everyone in our community has access to healthcare services. We want to thank you for joining us today, for helping us to maintain and work towards these outlooks and goals. So a bit about our history, and you're likely familiar, but just to go over it again, Project Access Northwest was a nonprofit formed in 2006. The goal was to improve specialty care for low income and uninsured individuals. We help people get matched up with volunteer specialists who provide care to our clients who otherwise might not be able to afford it. And we partner with hospital partners like Kaiser, Virginia Mason, and Swedish with pre-screened patients that are in need of specific services. When Project Access Northwest first started, we started with the top 7 specialties in King County. But since then, our program has expanded into Kitsap and Snohomish counties, and we have access to everything from asthma and allergy all the way to wound care. There's all kinds of specialties under that. So we can help people with a lot of different conditions. In 2021, we began initiating the addition of behavioral health as a specialty program. And then after moving parts and gaining more support, we were able to officially launch the Pro Bono Counseling program in 2023. So although it is one of the newer programs of Project Access Northwest, it's growing quickly and exponentially, and there's a lot of need for these kind of services. So we're very happy to be getting this out there and to be operating statewide as well. Okay, so kind of a look at who the clients we serve are. Our pro bono counseling clients are those who are either completely uninsured or underinsured, or likely only able to qualify for certain insurances like state insurance or Apple Expanded if they're eligible. Most of the time, a lot of these types of insurances, while they might have coverage, there are financial or other barriers that play a role in someone not being able to access care. So that's why we do focus on this area to try and meet that need. In order to qualify for our services, a person must be at or below 300% of the federal poverty guidelines. We have them linked here so you can quickly check on that. But in our area, for an individual that's, I believe it's a little bit over $45,000 a year is roughly that 300% guideline. So if you're below that, you'd be eligible as an individual. As of right now, we can only see clients who reside in Washington State, but we can operate statewide due to telehealth. The majority of our providers that we have had pledged are in King and Pierce County, but most of them are available for telehealth sessions, and we're always looking to expand our reach for in-person, for telehealth, really to just get providers from across the state to be able to meet needs across the state and be able to address local needs as well. And again, as of right now, we are only able to accept clients that are over 18 years old. This is not a hard and fast rule. We do hope to be able to accept all ages into PBC, but it is kind of dependent on our providers. As of right now, with most of them being volunteers and many student interns, we do have them only focusing on over 18. But that does depend on what people are willing to, what services folks are willing to provide. So continuing on, we have a look at just some just rough demographics of the clients that we're serving, showing race, ethnicity, and gender identity of our clients so far. And just to give you an idea of who might be coming through your doors, or you might be having a telehealth appointment with, and what the populations you might be serving are. Okay, so any questions so far? Have a quick moment for a quick Q&A break. Nothing. Okay.
Thank you.
All right. So starting on the process of how pro bono counseling works, starts with client enrollment. So we have several ways for clients to get to our program. They can self-refer on the web form, they can call us, or they can be referred from a community health worker or a few other methods. So we do accept self-referrals directly from clients. They can enroll in our web form, and I'll show you that later here in a little bit. But it's very easy. It takes about 5 minutes or less, just some basic information and several check boxes about like what are the general topics you'd like to address. It's quite easy for someone to enroll themselves. Otherwise, we do have a general line listed on our website as well, and a direct line to me as the behavioral healthcare navigator. And those are on our staff page. Clients can call me directly and I can ask them the self-enrollment questions over the telephone and get them enrolled right there. And then finally, we do accept referrals from community providers, community health workers, and community providers at free faith-based clinics as well. So far, especially in my experience, the majority of clients that we've received have come to us through self-referral, but all are welcome and encouraged. And we have had several referrals from other community health workers recently as well throughout King County. All right, so once a client has self-enrolled, these are kind of the next steps in the process. So as we see at the top with client enrollment, the multiple ways that they can be referred to us by either a health provider or a self-referral. They complete the client enrollment form, which is a HIPAA compliant form that we have. All of our stuff on our website is HIPAA compliant when it comes to self-enrollment or any of our web forms. And that's easily findable on our website. I'll show you that in just a moment. And then once that self-enrollment form is completed, I receive a notification and the client's contact information, and I reach out to them as realistically as soon as possible. I often reach out the same day or the very next day after someone self-enrolls, because that's when they decided they're ready to get services, they want help, and they're very likely to answer the phone. And I've had overall very good results with the self-enrollment. So I contact them and we schedule a time to complete the pro bono counseling screening. So a series, like a questionnaire about people's mental health history and their experiences, so that we can pass that on to you, the provider, so you have a good idea of who you're working with. It's overall, it's pretty short form. It's about half an hour to 45 minutes, and providers are always welcome to do additional screening if they want. We just want to make sure that we're giving a good general idea of what folks are currently experiencing and what they want to work on, and to make sure they're not in an active crisis, because we certainly would like to provide support for that before we send them off to you. So as far as the screening, clients participate in a confidential phone screening to discuss their concerns and their interest in seeking therapy, their history and experiences with counseling as well. When matching the client, we consider various requests like cultural background, expertise, gender, therapy style, primary language spoken. There are a lot of factors that can go into who we pair people up with, or if they have preferences. They may not always be available. It does depend on who we have pledged, but we do try to take as many of those into account as possible. Oops, sorry. And then when it comes to pairing a client with their clinician, the Charisse, the Director of Behavioral Health Integration, reviews all the completed screenings and goes through our list of providers and that screening and pairs them up for a best fit. She's looking at a bunch of different factors like the experience of the therapist, the concerns of the client and what they're experiencing, in order to make a good fit that they think is going to work out well. The provider receives an email from Charisse with the attached screening form, so they can review that and get an idea of who they're going to be working with. And then the provider initiates scheduling that first appointment with the client. So we inform the client that you've been paired up, and here is the name of your provider. You should be expecting communication from them soon to schedule your first appointment. And if needed, I can assist with that scheduling. So you could just reach out to me if you're having an issue, or you can just let us know if you're not getting a hold of somebody. But we also are starting a process to follow up after assignment to make sure that our clients did indeed make that connection and schedule their first appointment. So here are some examples of the kinds of questions we ask during the screening. Things like, letting people know that if they seem to be in crisis, we will support them with additional resources and connect them to a crisis center. Ask them about their experience with counseling in the past, if they've ever been hospitalized, or if they've ever struggled with substance abuse. Various questions like that. Some questions can be difficult for people to answer. They don't really know me, and there's not a lot of trust built up. However, I really try to emphasize that people don't need to share any details that they're not comfortable sharing. We really only need as much as they're comfortable sharing and as they're comfortable talking about, to give the provider an idea of what they want to work on. So I do try to emphasize to make it as comfortable an environment for them as possible. Okay, so here's a brief preview of what the screening form kind of looks like. On my end, it looks a little different in our web form, but this is the information that's on there. It's a little hard to see there, but it gives you basic demographic information, an idea of what would you like to work on, have you been taking any medications, and we have since updated this to be a little more specific as well. So I will show you that here in just a moment. See what's going on. There we go. Okay. So to give you an idea of how long it takes for a client to go through this whole process and to get set up with their first appointment, um, so once a client self-enrolls, we like to say care coordination assignment takes 5 to 7 business days. I typically try to make my first outreach call that day or the next day if I can. However, we don't want to bombard people with phone calls, so we will wait a day or so in between attempts to contact folks. So we like to say it takes about a week. I don't always get a hold of people on the first try. Um, but it can take about 5 to 7 days. It can be faster. After we complete that screening and I mark that as complete, it gets sent over to Charisse for review and assignment. That process takes about another 5 to 7 days. So I typically tell clients when I screen with them and as we're finishing up that it should be about 5 to 7 business days for you to know who you're assigned to, or at least some form of an update if we have to place them on a wait list, for example. Client sessions and the frequency, this is one thing that's great about this program. It's not limited. It's not just you can get this many sessions and that's it. That's all there's funding for. It is all based on the preference and professional insight of you, the provider, not on the client. And as it's volunteer, there aren't any technical limitations on that. So there's no barriers by insurance. We will only cover 3 sessions. And so that's up to both you and the client to determine what's needed. And then also right here, you have a picture of our what to expect form. So this is a really great handout that we send to clients after that screening so that they have a really good idea of what they're getting themselves into, what kind of support they can expect to receive, and what the timelines look like. We also have this form available in Spanish too, as we do have a lot of our clients are Spanish speaking. Okay. So we're getting to the part where Charisse would normally present this. So if I am lacking some of the expertise or the specifics in this, I do apologize. And if there's any clarification needed, we can always get that to you. But I'm briefly going to go over the requirements to volunteer in pro bono counseling. Our volunteers must have a current license to practice in Washington State. That includes mental health counselors, marriage and family therapists, and licensed independent clinical social workers, as well as the associates of all of those. And we do also accept certified peer counselors. There is some additional training for certain different types of providers. As a provider, you need to have liability insurance. If you're here in this session, you very likely already do, but say, for example, you have a friend who does not have liability insurance, they would otherwise be interested. We can help them access liability insurance if they are going to pledge to pro bono counseling, as there is a program for volunteer and retired providers that can provide free liability insurance if they're going to volunteer and provide free services with that. So really fantastic way to get even more providers able to give back to the community like that. Additionally, you have to have access to an electronic health record. We don't really care which one. We don't need to see your notes at all, but you do need to be taking them and placing them somewhere in a HIPAA compliant platform. And then have to have an active email address and checking it regularly. That typically is not an issue for providers, but it is important for receiving the client referrals to be able to check that regularly and stay on top of that. And then the completion of the quarterly hours form. So every quarter, we just send out a quick form, very easy report of how many hours did you pledge to our program. And I believe I have, there it is right here. It just asks what kind of service did you provide? How many clients did you see? That's pretty much it. We're not asking for individuals. We're not asking for names or what you worked on. It's just overall an idea of how many hours you provided, how many clients you saw. And this helps us to maintain our funding support and demonstrate the efficacy of the program. Providers receive a reminder email on the 15th of each of the respective reporting months. And then we have a link to that form as well. So we would send that out and send the reminder and let you know when that's due. All right. So one of the requirements is the Washington State Telehealth Certification. It's a training that takes approximately 6 hours, and it is available online. And that is linked here as well. And then this is the additional training that was required specifically for certified peer counselors. So CPCs, if you are a CPC looking to provide your services, you do have to attend this session. This one is in person only. So the barrier is quite a bit higher, but as you can see, there are some meals provided, but unfortunately, hotel and travel accommodations are not. So this could certainly be a barrier for some people. If this is a barrier for someone you know who is interested in providing in pledging as a provider to pro bono counseling, definitely have them reach out to us, and we'll see what we can do about trying to find similar or the same training possibly in their local area. And then some of the benefits to pledging with pro bono counseling. So there are numerous benefits, of course, benefits to the communities and individuals, but as a provider, you get some benefits as well that can both help you maintain up to date on what's going on in the field, as well as build towards an independent practice if that's something that you were working on. So one thing, several of our providers, we also appreciate the contributions in really any form of any of our pledged providers. That doesn't mean you have to see clients necessarily. Some of our providers also do things like consultation groups that as a pledged provider, you can participate in as well. So right there, you can see the Curbside Psychiatry Consultation Group hosted by Dr. Trenton James. He's a pledged provider. He doesn't see clients, but he does this consultation group, and he does psychiatry consultation that is open to any provider. And that's been a fantastic benefit to a lot of our providers as well in their daily work. And then we also like to just foster community of our providers across the state who are recognizing the need for behavioral healthcare access and making efforts to improve that. Along with that kind of community, we have a blog on there, Ask a Therapist blog. So very often, Charisse is writing articles about monthly, but we do invite every provider, if they wish, to write an article there. Also, there is a place for patients or for clients to ask a question directly. So clients can submit their own questions to that blog, and then any of our pledged providers can answer that. So they can directly get their question answered in a blog format by a therapist related to mental health, which is pretty cool. It really invites in individuals to get questions answered by someone with expertise, as well as a platform for community building with all of our providers. So if you'd like to contribute to that, please do. And then some of the other benefits, I already mentioned the liability insurance, kind of get you into the door as pro bono counseling. And if you are providing counseling for at least one of our clients, you are eligible to receive free continuing education units offered through the Washington Mental Health Counselor Association. Those change super frequently. They are always offering new courses, and they are totally free if you are seeing clients through pro bono counseling. That can save a ton of money for somebody who needs those for their licensure. And then at the end here, we just have a quote from the National Association of Social Workers, just kind of speaking to really the overall community benefit and part of the reason for doing this. And it's social workers' primary goal is to help people in need and to address social problems. Social workers are encouraged to volunteer some portion of their professional skill with no expectation of significant financial return, in parentheses, pro bono services. And so, just you being here, and obviously, in your case, Steve, your legacy with pro bono counseling, your dedication to pro bono work demonstrates your commitment to these values, to promoting well-being and improving mental health outcomes for underserved populations throughout our community. So we'd like to thank you again for being here and for your support. And a couple frequently asked questions that we often get. Can clients complete and sign individual practice forms at provider's practice? Yes, they can. Absolutely. Should I notify Pro Bono Counseling if I schedule a client for counseling sessions? Please do. Notify us via email. I should change that to Navigator, but me, the care navigator, can also assist with scheduling if needed. So if there is any issue with that, please reach out. I'm happy to help reconnect with that client and get that taken care of. And what if I can't accept a referral? There are times when our volunteers might be busy, their caseloads might be full, or maybe they don't think it's the best fit for themselves, or maybe for some of their student interns, situations like that. Not a problem at all. Just notify us. We can always reassign the client. It is, completely understandable, and especially given that this is all on a volunteer basis. You know, we can't always expect everybody to consistently take the same amount, or, this is what you pledged. We understand that you're giving your time as well. So we're completely understanding of that, and we can reassign that client. Okay. So additional information, you can find lots of extra information on our website, Project Access Northwest website. And I will show you that here in a minute, as well as our self-enrollment form. But on that site, not only have a bunch of information about all of our staff and their contact information, we have a Meet the Providers page, which is really great. It's a little blurb written by each provider that we post there, so that as clients self-enroll, they get an idea of who they might be working with. They get an idea of who the folks are in the community that are donating their time to help improve mental health outcomes. We have other provider FAQs on there. The what to expect form that I briefly pointed out there, as well as in Spanish. And then a whole host of mental health related resources. We have self-assessments on there. That can be a really great way for someone who's contemplating counseling. If they're not sure, but they have been talking about some issues, they can take some of the self-assessments and screeners as far as things like anxiety or depression. And then there's also resources on there, just general mental health resources and crisis resources, because of course, if somebody is in crisis, we need to support that first before we are going through this process to get them to your office. And then the PBC SharePoint. So we have also created a SharePoint, which is kind of our community space for all of our providers. This is where we share out any updates that are relevant to any of you. So if there are support groups, a new consultation group just started. I recently sent out some notifications about new CEU courses that were released and new topics. So really anything like that we'd like to announce to you all. This is where we would post it, as well as just any additional resources, things like that. And then once you are in the Pro Bono Counseling group email, you also have access to this SharePoint. So I can send out those notifications, but you can always refer back to this to stay informed about what's going on in PBC in the behavioral healthcare space across the state. And then this is just kind of our flyer for the continuing education workshop with a link to sign up there. And we encourage you to frequently go back and check it out when there are new courses posted. I occasionally will check and update. I'll send out a SharePoint when there are new courses posted every couple months, and I'll just let people know, hey, there are some new courses. These are some great topics. Go check them out, and you can just sign yourself up right there. All right. So I didn't realize we were doing this. Screenshot time. So yeah, we'd like to take a photo if that's okay. Steve, are you all right if I take a brief screenshot here with everyone? All right.
That's fine.
Perfect. Well, I will take it in just a minute here. But we will take a quick photo so that we can post that to our socials to promote the program as well. And I'll stop sharing so I can get a quick screenshot of us all. All right. Everyone say cheese. Beautiful. That's very nice. Very nice. All right, let's see. Let me share that over to you all. Right? Pretty good, pretty good. Okay. So, back to the end of this. There we are. Okay, last couple slides here. Yeah, the last one here is any questions at all, and I can't see anybody. Sorry. Nothing? Okay.
I have a quick question, and
Yeah,
maybe
absolutely.
this is for Gary instead of for you, Dennis. But I'm wondering how the Pro Bono Counseling program is doing. I know it's been up and running for a while, and do you have lots of therapists now and lots of support? Just curious to hear.
Yeah, I think from our perspective, Steve, it's going really well. I think that um, our goal by 2026 is to engage up to 200 providers. And I think we're well on our way to achieving that goal. So as I think as Dennis said at the beginning of the call, we have quite a few providers already, and particularly in King and in Pierce County.
Okay.
We even have one who's providing services that was in Canada but is licensed in the state of Washington. So from that perspective, I think doing really well. And then I think on the side of the side where we're asking folks to either be referred or refer themselves, that's going also well. And people
Yes.
aren't having to wait a long time to access the care that they need. So I'd say that it's going really well and has a really bright future to it as well. I know that we've got our fingers crossed that the state legislature will continue to fund the program in the next biennium budget being passed in this legislative cycle. And we also see a number of foundations kind of stepping up as well and funding. But also hospitals and our other partners. So I'd say it's going really well. And again, kudos to you, Steve, for having helped us in the early days to lay the foundation.
No, I didn't do much, I know, but that's great to hear you're doing really well. Sounds great.
Thanks.
Thank you.
All right. Well, that brings us to the end of the PowerPoint. I can briefly go through the website, but just here is the contact information for Charisse and myself, and I'll be sending this PowerPoint out to you as well, along with that, the evaluation. So with that finished, let me quickly find my correct page. I believe I've got it right there. Okay. All right. So we should be all seeing our Project Access Northwest webpage. Just overall, wanted to point out a couple of things like our wonderful banner. This is the home page, and we do like to advertise their providers that pledge their services, whether that's to our clients or to the provider community. And as you can see here, we've got Dr. Trenton James and his consultation group prominently advertised. And then things like, just some of our basic statistics that are fantastic at Project Access overall. Just kind of showcasing how we're able to assist people. To get to the Pro Bono Counseling page specifically, you just hover over programs, come on down to Pro Bono Counseling. And from this page, first things first up at top is that a crisis statement. If an individual is in crisis, these are the other lines to call. Now, if somebody does call us in crisis, we have training and procedures for that in order to get them help. But our goal is to not have folks in active crisis on the line with us, and we definitely don't want to be passing them on to counseling immediately. And then if you scroll down just a little bit, it makes it very easy to enroll. So I'm going to show that first. Enroll as a patient takes you directly to our client self-enrollment web form. This takes just a few minutes to do. So there's some basic demographic, location, some income information, and then a bunch of boxes to check on what kind of stuff would you like to work on. So not a lot of detail is needed here at this point, and then I contact the client, I reach out and call them, and we complete the more thorough screening. But all this does is it just gets them into our system, so I know to reach out and call. So that's super easy to do. We also, just below that, make it very easy, similarly, to volunteer as a clinician or as a graduate student who's working towards licensure and wants to volunteer their services. These take quite a bit longer. These are much more involved forms. I think it was the other one. Huh. Oh, there it is. There it is. So this one is much longer and more detailed, but it doesn't take too long. It takes about half an hour from what I have understood from Charisse and some other providers. And then as well as those enrollment forms, as we scroll down, we have a bunch of other things on here. Meet our providers. So this is just a basic overview, when people joined, and a brief little blurb about who they are, what they do, or why they're wanting to volunteer their services, which is fantastic. And so people can get a little bit of an idea of who their counselor might be before they end up getting assigned. Then we have various resources, mental health helplines and resources, all kinds of more specific resources, whether they're for more complex needs, specific population groups that could use more dedicated or cultural support, things like that. Our assessments, if you have someone, maybe a client who is contemplating services, this would probably be very good for, say, social service organizations, if they're assisting somebody with housing who is starting to talk about their depression, maybe you could point them to one of these, and doing a mental health test, a depression and anxiety test, might convince them that, like, yeah, I actually could talk to somebody about this. We have crisis resources, which is very important to help us make sure we are stabilizing people before we pass them off to work with a counselor. Our Ask a Therapist blog. So from here, we have a few of our posts, most of these very often written by Charisse. One of them was an interview she did with the executive director of the Kitsap Brain Injury Group, which is works with people who are survivors of traumatic brain injury. So that was super interesting, and how that kind of interfaces with the behavioral health lens that we apply. And then this button here to ask a therapist. Clients can just directly ask their own questions and have that answered by Charisse or one of our providers, which is very cool. And then finally, we have our what to expect in English and Spanish. So just to show that briefly, it's just a brief one-pager with contact information and just a very straightforward, just an explanation of the process. How long does it take, what to expect, and who will be reaching out to you? And finally, we have that in Spanish as well, which is super useful. So that's our website, and I believe that's the end of the provider onboarding. So
Great.
Thank you so much for joining.
Well, thank you for going over it for me. I have some understanding of all of it, but it's helpful to really see. And
Of course.
yeah, honestly, things have been going pretty well with a pro bono client I'm seeing now. So I really enjoy the opportunity to work with you all, and it's really meaningful. It's really powerful that this is happening. So in the state of Washington, which is, or in King County especially, which is one of the wealthiest counties in the country. So I know there are inordinate needs here too, and it's amazing that, Gary, I know you really have spearheaded this. It's really powerful that you've done so. So thank you for that.
I appreciate that. Thanks. Stephen, let me stop the recording, and Dennis, let me stop the recording here.
Sure.